Hello, everybody. So, today our topic is around breast care, as this month is Breast Cancer Awareness Month. Okay, so today we have Dr. Susan, who is general surgeon and who has undergone advanced training in breast surgery. Okay, and so first of all, let me introduce myself. My name is Anjali, and I have been women's health fitness trainer for past 8 years, and I have just added nutrition counseling, and of course, I'm the founder of this platform. Okay, so now let me read Dr. Susan's bio. I will just, hi Tegan, thank you so much for coming back. Yay, here we go. Yes, I think you will have to send me again. Okay, so I'm just going to read Dr. Susan's bio. Oh, you got it.
Yes, I can only join on my phone.
Oh, yes.
So that's all
Yay. Well done. Fantastic. Welcome.
right.
Thank you so much for coming.
All
Yes.
good. Sorry about that.
No, that's okay. It's all, learning curve, isn't it?
Yeah.
Yes. Thank you
Well, thank you
so much.
for inviting me to chat as well, because breast cancer affects so many women, so it's a really important topic.
Absolutely. Yes. So I'm just about to read your bio,
Thank you.
and we go further ahead. And so Dr. Susan is a general surgeon who has undergone advanced training in breast surgery. She was born on the Gold Coast and trained in Queensland. After completing her general surgical training, Dr. Susan pursued subspecialty experience in breast cancer and reconstructive surgery at Canberra Hospital and leading oncology hospital Chris O'Brien Lifehouse in Sydney. Dr. Susan is mother of two girls, aged 2 and 4. She works at Gold Coast Private and Pindara Private Hospitals. That's amazing. Thank you. And you have beautiful little girls, 2 and 4. Mine one is all grown up. Are you still there? Send a request to the, okay, view request. Okay, so this is interesting. So can everybody hear us? Okay.
Are we back? Yes. It keeps dropping out.
Yes, you're back.
Yeah.
Okay,
Yes.
so awesome. Okay, thank you everyone for being here. So, yes, so I've just read your bio,
Yes.
and before we start, thank you, Tegan. And before we start, I just wanted to let people know. So before we start, I just wanted to let people know that this is just a general information to empower you around this, the breast care, right? So not a specific advice for you. So if you have any worry or any concern, please, please see your practitioner. Okay. So yeah. So would you like to add anything else, or before we start?
No,
Yes.
it's all good.
Oh, yeah. And I wanted to let everyone know that we will have Q&A session at the end, or if you have any questions, just comment down below, and and we will get into it. Okay. So first of all, very basic question: what is the breast care, and what does it involve? I am not sure what's happening. We are having issue with, okay, so all right, okay, looks like we will have to come back again, so I'm not too sure what's happening, except, all right, so this is a little bit of a hiccups happening here. So
Hello. Back
okay, so I
again.
think, are you on the computer or?
I'm on my phone because the computers were dropping out here at the hospital. So
Yeah,
yeah.
so
Otherwise,
I think it,
Yeah.
Yeah,
If
yeah,
if it's too tricky, I could phone through and call you if it doesn't work on the
yeah. All
Instagram along.
right.
Yeah.
Yeah, yeah. All right.
But we'll
So we will just figure out something if
yes.
it doesn't work.
Yeah.
Okay.
That's
Thank
okay.
you, everyone, for being so patient. And because technology is technology, right? It has its own mind some days.
Yeah.
So, yeah. So, yeah. What is the breast care and what does it involve?
So breast care, it revolves around identifying potential issues or concerns that women have with their breasts. So this can include performing regular self-examination so that you know what's normal for yourself.
Mm,
So visually inspecting the breast, see if there's any obvious changes like rashes or redness, dimpling, obvious lumps on the breast or the armpit area,
mm,
if there's any new discrepancy in size, if you've got any new nipple discharge sorts of symptoms.
mm.
Breast care also involves having breast imaging, such as ultrasounds and
Yeah.
mammograms, and seeking medical advice when you are worried about your breasts. And it's also about finding out if you've got a particular family history that increases your risk of breast cancer. So there are some families where there is a number of people that do have breast cancer or ovarian cancer, so it's good to know one's own family history as well.
Oh, okay, fantastic. So it's yeah, so it's to do with the family history as well as the
Yeah.
yeah, so yeah, okay. So and you told us about the all these it's not symptoms but the changes in the breast, right? To keep an
Yeah,
eye out on the
that's
breast. Okay. So
right.
yeah. So dimplings, what does the dimple it's like a dimple. It happens like a dimple in the breast, is that correct?
Yeah, so the skin looks like it's being pulled in a little bit.
Ah, okay.
A lot of women do actually present with breast pain, but that's often not a symptom of breast cancer.
Okay.
But they may end up finding other things when investigations are performed.
Yeah.
So it's good to know that most of the time breast pain isn't something really sinister,
Yes.
but it's always good to get checked. Yeah.
Yes, yes. And you mentioned about the scanning as well. It will have the scanning in the process,
Yes.
right? Yeah.
Yeah. Once people start getting symptoms in the breasts, or if they notice changes in the breasts, then the usual next step is to have a scan.
Yeah.
And in young women, we usually start off with ultrasound. In women who are 40 and above, then we may do ultrasound with a mammogram.
Oh,
Yeah.
okay. Fantastic. Yes. And then with the mammogram, the we have the government provides the free service as well, isn't it? So the 40
Yeah.
plus for the 40 plus women, is that correct?
So breast screen, it is a screening program, and people or women that are aged between 50 and 74 are typically invited, but women who
Okay.
are 40 can opt to attend breast screen to
Oh,
have a
okay.
mammogram. Yeah, and usually that's every 2 years.
Yeah. Yeah, okay. Thank you for the information because I have done it, and so I just wanted to people to know that
Yeah.
it is available for you. So
Yep.
no excuses.
Yeah, it's free. So
Yes, yes,
a lot of
exactly.
women have a lot of anxiety though because they may notice some change in their breast or they may have a family history. So sometimes women get a bit scared, but it's good to be proactive. And if you know somebody that is a bit scared, it's good
Yes,
to be a friend and to encourage them to find out if there is actually a problem or not.
yeah.
Because if things are picked up early, survival can be very good.
Higher chance, isn't it?
Yeah,
Yeah,
that's right.
awesome.
Yeah.
Yes. And so, what are the common myths that you have come around the breast cancer or around the breast care?
Yeah. So women, they're usually pretty worried when they do feel a lump that they've got breast cancer. But in 80% of women, the lumps won't be cancer, which is a reassuring thing, and they may be a benign lump.
Yes.
Some people think that only women who have a family history of breast cancer will end up having breast cancer, but this isn't necessarily true. The majority of women who are diagnosed with breast cancer, so about 70%, there will be no family history. So just because you don't have a family history doesn't mean that you can't get it. You're still at risk. If you've got breasts, you're at risk
Yes.
potentially. Some women think they may be too young to get breast cancer, but
Mm.
breast cancer can affect younger women. It can affect older women. And a quarter of women who are diagnosed with breast cancer are younger than 50 years of age.
Yeah.
And according to some research from the National Breast Cancer Foundation, one woman under the age of 40 will die every week from breast cancer. So
Wow.
it's something that we shouldn't just ignore.
Yeah.
There are other myths that used to um, be worried about in the past, such as deodorant and underwire
Mm.
bras causing breast cancer, but there's no evidence of that at all. Women get breast cancer, but men can also get breast cancer. And because men are often not as proactive, breast cancer
Mm.
in men usually presents at a more advanced sort of stage. So
Oh, okay.
usually the men are older, but they're also, because they ignore the symptoms,
Yes.
it ends up it usually is spread by the time that they do actually seek help. But in the last 10 years, the number of breast cancer diagnoses have increased by
Yes.
about 24%. And that might be due to improved
Yeah.
screening programs where we can pick up breast cancers at an earlier age as well, or earlier stage, I should say, and also the improved awareness campaigns.
Yeah. I think that number has gone up because
Yeah.
people are being aware and being
Yes.
proactive around the situation, right?
Yeah.
So,
That's
yeah.
which is good.
The,
It's really good. Yeah.
yes. So I'm just interested, like how the male would have the similar symptoms, or now I know it's out of topic, but it's just out of curiosity because it's rarely heard of that male
Yeah.
would get breast cancer as well, you know?
Yes. Yeah. It's rare. So the risk for a man is, they say, about 1 in 500, 1 in 550.
Okay.
So whereas women, the risk of breast cancer in Australia is about 1 in 7.
Okay.
So which
Yes.
is pretty high,
Yes.
unfortunately. Um,
Mm.
there are some genetic conditions where men are more likely to have breast cancers, but they sort of present usually with a lump in the breast. They may notice lumps in the armpit. Sometimes there
Yeah.
can be changes in the nipples. So if you notice that your other half, or if you've got a male in the family that's having concerns about their breast, it
Yes.
is important to get it checked out. Sometimes, again, it might be something benign, but it's good to be a bit more cautious when things change. Yeah.
Yeah. So that leads to these, like similar to they would that be similar symptoms with the female as well, like the lumps?
Sometimes,
Yeah.
sometimes. So, breast screening. So, usually breast screening is recommended before you actually have symptoms, and the whole goal of breast screen is to pick up early cancer
Yes.
at the stage where you can't feel it. So some women do present with lumps or
Yes.
cancerous lumps, but the majority of women who attend breast screen, it's found before there's been a chance to develop a lump. So.
Yeah.
But
So,
it's interesting these days. We do still see people with very advanced breast cancers that they
mm,
may have been told previously they had benign lumpy breasts, and
yes.
sometimes they don't seek any follow up or scans for several years, and then they can present in quite an advanced stage as well.
Yes. So I'm one of the person that sometimes I can put off my doctor's appointment. So
Mhm.
don't be like me, everybody. Please go and check it out if you're worried, and
Yeah.
or do your regular checkups, right?
Yes.
When your doctor, yes, advise you to do so.
Yeah.
Yeah. So what are the what are the points that you would advise for the prevention side?
So being aware of your own breasts is important. You don't have to book in to see anyone but
Mm.
yourself. It's free and it's easy and it doesn't hurt and it can save your life. So there are different resources that women who if they're unsure about how to examine themselves, there's a lot
Yeah.
of information by reputable resources such as the Sydney Breast Cancer Foundation about
Okay.
how to do self-examination. You can
Yeah.
always ask your doctor as well,
Yeah.
because the thing is, you may see a doctor once in a while, but you see yourself every day. So
Yes.
um, you probably will be the first person to notice a physical change.
Yes.
You should act on any changes that you notice and that you're worried about. Um, and you should attend breast screening. So as I mentioned, breast screen, you're invited from 50 to 74 years of age, but you can attend at a younger age, at 40, if you're
Yeah.
worried. And you can still have mammograms after 74. So just because there is a bit of a cutoff with breast screen, women are still at risk of having breast cancer when they're
Yeah.
older. Um, you should try to be supportive of friends and other people that you know who are going through the breast cancer journey,
Yeah.
because sometimes women do feel quite isolated
Hmm.
and obviously very scared.
Yeah.
And it's because it's so common, it is good to have people that you can talk to about what's happening to you. Um, Other sort of lifestyle things that are good is to avoid drinking too much alcohol, because
Hmm.
alcohol is a known risk factor to
Yes.
increase your risk of breast cancer. We always say it's good to stop smoking if
Yes.
possible for your own health, and trying to increase one's physical activity and avoid becoming too overweight is good as well, because both being a bit overweight and a sedentary lifestyle do increase your risk of breast cancer.
Okay. So the it's more of like, yeah, so doing the regular checkups
Yes.
and being supportive of people, and yes, and then so we can prevent it to before it gets too serious. How do you say it?
I guess
It
too
gets before it gets,
advanced. It
yeah,
gets too
too advanced.
advanced. Yeah.
Yes, and so and I guess if it is not if it gets caught at the beginning, I guess the process wouldn't be as invasive as well, would it?
Yeah. So if a breast cancer is detected earlier, then it may not have spread to other parts of the body. So
Mm,
in the breast, often the first place for it to spread is the lymph nodes in the armpit.
yeah,
So if it's caught early, it may not have spread there. It may not have spread to the rest of the body. And then what sort of surgery and treatment may be um, not as aggressive
yeah,
compared to if you left it for a long time and it became very big or it had spread.
yeah.
So sometimes if it's picked up very early and it's a small tumor, we might be able to just cut out a small lump rather than do a
Mm,
mastectomy. So
yeah,
which a lot of women would prefer to keep their own breast tissue than
yes,
have a mastectomy. Yeah.
yeah, yes,
Overall
yeah,
survival is much better. So, when it's caught very early, the 5 year survival for a stage one breast cancer is almost 100%. Whereas if it's spread to different areas of the body, what we call stage four
yeah,
disease, where it's spread a lot, the survival is about 32%
yeah,
in 5 years. Yeah.
yes. So everyone, just take care of yourself, okay? And so I know I didn't put in a question, but I wanted to add in what is the aftercare look like if the person goes through the mastectomy and things like that? And what would you suggest those people to do to take care of themselves?
So, it depends if the patient just has a simple mastectomy and they go
Mm.
flat. So, or if they've had reconstruction, because there's different types of reconstruction options as well. So, um, some breast surgeons can help reconstruct a breast with breast implants or tissue expanders, which are temporary breast implants.
Yeah.
Um, Patients may have what's called autologous reconstruction, where a plastic surgeon helps to create the breast after a breast surgeon has performed a mastectomy. Women with mastectomies, they may have drains for a period of time to
Mm.
help manage fluid. So I guess a lot of the initial recovery is a short-term thing, like having drains and with the wound healing. But
Yeah.
then the process takes some time to recover because obviously there's been a big surgery and a lot of emotional toll on women. So sometimes the recovery can last for a very long time, and
Mm.
it's a lifelong change for women to have had breast cancer and then to
Mm.
have some sort of surgery on their breast. So they often have ongoing support with friends and families, and there are support groups as well for them.
Yeah.
So I guess everybody's journey is different, and what they need as well. You could ask them what they need, because sometimes what they need straight after surgery is different to what they need in the future, because they might just want to be left alone initially
Yeah.
because there are different stages they're going through, whereas in
Mm.
a few months' time they might want your support and may want to spend
The
more time with
guidance.
others. Yeah,
Yeah.
yeah.
So would you recommend around because the looking after taking care of yourself and well-being is such a big aspect of, the taking care of them like ourselves, right? So is
Yes.
there any particular things that you would recommend for their well-being?
So having a little bit of regular exercise, even
Mm.
after you've had some surgery, some gentle exercise. There'll always be particular recommendations from your own surgeon, but uh, I don't think we should downplay the benefit of
Mm.
exercise. It can make you feel better. It helps to release endorphins. Eating well, attending appointments, and just asking for help if there are things that you're going through that you think you're not coping, because it's it's always we don't know if people don't ask us for help, then it's hard to know what they're going through.
Yeah, so you can always advocate for yourself what you are.
Absolutely.
Yes,
Yeah.
what
Yeah.
if you're wanting to try some sort of, like, even there are organizations or the people who helps the cancer survivors with the free exercises. The government, they provide the free exercise classes, right? And then Kiara, the one of the members in our group, she does she's exercise physiologist, so
Yeah.
she creates these programs to support the cancer patients. And one of the ladies, she has this organization, this platform where she provides the wellness side, the massage and
Yeah.
meditation, those kind of people brings together.
Yeah.
So there are help out there. You just have to, being able to ask, and then and you can your practitioner can guide you through, right?
Absolutely.
Yeah. And so, yeah, I think if anyone has any question, please comment down below. So while we wait for the question, please let us know where we can find you.
So I work at both Pindara Hospital
Yeah.
and Gold Coast Private Hospital. The consulting rooms are at Gold Coast Private Hospital. It's suite number 1, which
Yeah.
is right next to the front door. And yeah, we usually just need a referral from a GP if there's any concerns about breasts or general surgical problems.
Yeah.
Yeah, yeah.
Yeah, that's it. And your website. And yeah, I think I'll put all the details in the content as well.
Yeah.
So yes, I think we would love to. It's the Breast Cancer Awareness Month, so we will be talking more about it, regarding it, and we will see, and maybe we'll collaborate again. So we'll see.
Yeah.
Okay. And thank you so much for being here. Thank you, everyone, for being here. And then, yes, we'll talk soon. Thank you so much.
Thank you for your time. Bye-bye.
Okay. Bye. Thank you. Okay.